Welcome to Business Connections. This is a show produced by the Dayton Area Chamber of Commerce. I'm Holly Allen, Director of Marketing and Communications for the Dayton Area Chamber of Commerce. With me today is Bryan Bucklew, President and CEO of the Greater Dayton Area Hospital Association, also affectionately known as GDAHA.
Yes.
Thanks for being with us today, Bryan.
No problem.
On this show, we usually focus on things, especially in the business community, that are really positive going on. Of course, everyone in the Dayton area knows that we are known for innovation, everything from the Wright brothers to the National Cash Register Company. But a lot of times the stories we hear are not really from this era.
Correct.
So here we're talking about a new program that will actually hopefully create new stories we can tell about innovation in the Dayton area. It's called the Ascend Project.
Absolutely.
Is that correct?
Yes.
I want to back up, though, because we
Sure.
talked about GDAHA and who you represent. And I think it's important to know what GDAHA is. Can you tell us what you do for the healthcare industry in the Dayton area?
Sure. We're a regional hospital association, so we have 29 member hospitals, and we go as far north as Grand Lake St. Mary's up in Auglaize County, and as far south as Atrium Hospital and Fort Hamilton Hospital in Butler and Warren County area. We go as far east as Springfield Regional Medical Center and as far west as Wayne Hospital in Greenville. So we have 29 hospitals.
Wow.
Most of them are short-term acute care facilities, Miami Valley, Kettering, Good Samaritan, Southview. Then we have 2 long-term acute care hospitals, Kindred and Life Care. And then we have the Wright-Patterson Air Force Base Medical Center and the Dayton VA that are also members of our association. And we focus in on collaborative projects that benefit the entire community, whether it's mental behavioral health, electronic health records, health information exchange, exchanging medical records between different facilities, and then a lot of data analytics in addition to the public policy issues that are so prevalent today, both on the local, state, and national area. So our board is made up of our 29 hospital CEOs, and then we have probably somewhere in the neighborhood of 24 different task forces of our association that works on different projects. So last year at this time we were fully focused in on Ebola training, Ebola identification, Ebola protocol, and now we're working on mental behavioral health issues in our community. So whatever the major health issues are for our region, we kind of coordinate and collaborate the hospitals working together and kind of lead the effort to address those issues.
So it's kind of, it's essentially a membership organization that brings all those hospitals together and makes sure they're talking to each other.
Correct. And it's something that's very beneficial for not only the hospitals but also for the region. So if you take the top 100 metropolitan regions in the country, we're one of only 10 that doesn't have a university hospital, public hospital, city hospital, county hospital. So we're in a much different situation than our neighbors in Cincinnati and Columbus and Toledo and in Akron and Cleveland, where they do have access to public hospitals and university hospitals. And so it really encourages our hospitals to work together. So for example, if somebody is in the residency program at Wright State University, they complete the residency program in 8 different hospitals around our region instead of just one university hospital. And that there's some positives and some challenges associated with that, but it's a good thing because all the hospitals are working together throughout the Kettering system, Premier system, Dayton Children's, Springfield Regional Medical Center, and our surrounding hospitals also.
Good to know they're all talking to each other.
They
you
are.
have to go to different hospitals. One of the things, so you're taking this even further, the collaboration. So this summer, you came out with this program. It's called Ascend, and it's really aimed at innovation in the healthcare industry, correct?
Yep.
Can you tell us about kind of the basics, what that idea, what that idea is and what it's aimed to do?
Sure. The genesis of the idea occurred at one of our board meetings where we were updating our economic impact and employment study. And so we do this about every 3 years. And as a benchmark, we always benchmark ourselves with Wright-Patterson Air Force Base. They're kind of the holy grail of economic development in the Dayton region. And they have a $4.5 to $5 billion annual economic impact. The hospitals that we represent at the Greater Dayton Area Hospital Association have about an $8.1 billion annual economic impact. And they directly employ about 35,000 individuals in our community. So it has a huge economic and employment reach. And the reason why we started doing that was it was an easy way for us to communicate with elected officials when we had Medicaid issues or we had service delivery issues or the closure of Twin Valley, which was our state psychiatric hospital, on the impacts that could have both from an economic and employment perspective in addition to the medical issues for our region.
Right.
But our board challenged us by saying, well, how do we leverage that economic impact? And what came of that was figuring out how do we better partner with Wright-Patterson Air Force Base, what's going on at Air Force Research Lab, the Health and Human Performance Wing, it's the headquarters of aerospace medicine. Is there a way where we can really partner with them, with our hospitals, to figure out how can we improve the economic development in the region, the economic investment in the region? And we came up with this joint venture called Ascend, and we're partnering with a company out of Cincinnati called Kaleidoscope. And our hospitals with Dayton Children's, Premier, and Kettering jointly funding the first 3 years of operations of this. So those competing hospital networks are joining together to fund this, and it's really to create medical devices, medical innovations that will go to market. And so when we made the presentations to our hospitals, we didn't make it to the hospital boards or to their foundations, we made it to their investment committees. So this is a for-profit joint venture. We're not seeking any government funding. We didn't look for third frontier funding from the state of Ohio. We didn't look for funding from Washington, D.C. It's all privately funded, and it's really to figure out how can we get devices to market utilizing the technology that's here at the Dayton region and also at Wright-Patterson Air Force Base. So it's a unique model. I don't know if I just presented at our national association, and there's no one else in the country where you have competing healthcare networks joining together on innovation. And it's something we're very excited about. We're going to be co-located in a downtown location in April. So we'll have about 8 to 9 people working on the Ascend team. We'll have the 8 employees of Gedaha co-located together, working together to develop products. The innovations that we're looking at is basically anything that's in the medical field that is not pharmaceutical or implant related.
Why is that?
Just because there's such a long clinical trial timeline to get approval from the FDA. What Kaleidoscope brings to the table is they are a design innovation firm, and they're made up of former employees of Procter & Gamble, Johnson & Johnson, Ethicon, that have really taken ideas to market and in the private sector side. And they also have an ISO medical device designation, which allows them to expedite the FDA process. And so that allows us to work on products that are not implantables or pharmaceuticals and get them to market really quickly. We hope to have our first exit by the spring of this year to develop, and our hospitals are really excited about this program.
Well, you talk about the hospitals being involved, and you went to their investment groups, I guess. So you're all about collaboration, but let's be honest, they're competing against each other in the grand scheme of things. How did you get them on board to say, yes, we want to invest along with some of our competitors?
Sure. At the end of the day, we're really focused, while the Kettering Network and the Premier Network and Dayton Children's do compete for a lot of the same patients and for market share in the Dayton region, the actual competition that the hospitals realize is the Dayton market versus the Cincinnati market, the Columbus market, and the Cleveland market.
Okay.
And we want to make sure, we don't have a lot of resources organically or governmentally that those cities have, the 3 Cs in the state of Ohio and Toledo. So we don't have a university hospital where you have a lot of research and innovation coming through. We don't have the strong corporate base that a Cincinnati or a Columbus or Cleveland does. So we don't have a Procter & Gamble or Great American Insurance here. And so we have to do things a little bit differently. And one of the assets that we really have that no one else has is our proximity to Wright-Patterson Air Force Base.
Right.
So we figured the partnership with the base made a lot of sense. And from the time that this idea was discussed and operationalized, it was less than 8 months. And so our hospitals were really focused in together. And there's four different pipelines coming into the Ascend area. One is the intellectual property opportunities and partnering with Wright-Patterson Air Force Base. Another is taking the partnership with the Dayton Israeli Trade Alliance that Montgomery County has developed. There's a lot of opportunities to partner with some Israeli companies to develop technology, especially in the medical field. The third thing is some of the national companies that Kaleidoscope has worked with. They've worked with Fortune 100, Fortune 50 companies that are very interested in partnering with us and to develop these medical products and to get them to market, whether they're wearables like Fitbits or exercise enhancements, and then the absolute opportunities within the hospitals themselves to develop IP. So the great thing about this project is if something gets developed at that is an idea that comes from Premier or from Kettering or from Dayton Children's, they're all going to benefit from that coming out. And they have a vehicle in order to develop that intellectual property and to do that innovation, which we didn't have before. So it's something that's gaining a lot of attention, not only regionally, but statewide and across the country on how we're putting this together. And the hospitals, the Kettering leadership, the Premier leadership, and Dayton Children's leadership should really be commended for doing something together jointly.
Absolutely. The idea itself is innovative, but the idea that it will create more of these stories of innovation is really exciting in the Dayton area.
And I think, you know, we've had some, I would say, mixed success in terms of trying to develop and commercialize technology coming out of Wright-Patterson Air Force Base. And we think some of the challenges before have been, they've all been government-based. They've all been looking for grants or funding from the state government or federal government, or working through the university system. This is set up as a business plan. So there is a business plan, there's a business pro forma. We made presentations to the investment committees. And so this is a multi-million-dollar investment where we think we're going to have significant returns on that investment. So this is just not some philanthropic endeavor that the Hospital Association and our hospital members are trying to do. This is to look to actually have quantifiable returns on investment, job creation in the region, very metric focused, and we think it's going to be a great opportunity for the Dayton region, and we think it's going to be very successful.
Absolutely. How does an idea from start to finish, how does it come into the Ascend program, and how do you then foster it so that it can become something that is sellable?
Sure. So what Kaleidoscope brings to the table is the employees of Ascend are either former Air Force Research Lab individuals, former Kaleidoscope individuals that have really focused in on developing intellectual property. So we are not working on projects or products where we don't have an ownership into the intellectual property. So we're either going to organically create things and have the patents and hold the patents, or co-develop or add intellectual property to an existing device.
So you're not buying an idea from a small business that would
so we want to co-develop that, and so we have bioengineers, we have scientists. Actually, Air Force Research Lab has been so gracious to partner with the Greater Dayton Area Hospital Association, so we have an embedded scientist from Air Force Research Lab working for a year that the Air Force is paying to figure out how do they help commercialize technology, because the Air Force is under pressure in the Department of Defense to figure out, are there other ways to leverage the billions of dollars that they spend on research and development into the Dayton region, and not only at Wright-Patterson Air Force Base, but across the country. So we think there's some significant opportunities here, and so these ideas come in, they get developed. The space that we have 3D printers, so we can prototype different devices. We have computer software where you can engineer them. We have software developers where if they could be apps that could go on Android devices or iPhone devices. So there's some really unique opportunities. And we have a willing partner with Air Force Research Lab at the base, and so we think that there's just the amount of intellectual property that's available out there. We know we're on to something when we have Ohio State calling us, and we have the Cleveland Clinic calling us, and we have the University of Cincinnati calling us, trying to figure out how can we be involved, how can we participate in that. And we'll work with anyone, but the goal here is to have a quantifiable return on investment, increase the number of jobs, increase the amount of investment in the Dayton region in terms of hard dollars, and to grow jobs here and to have them located here. So we'll have these strategic partnership agreements that kind of overlay any type of agreement. So if a company that is located outside of Dayton wants to work with us to co-develop, they have to have a physical presence here in the Dayton region.
Wow,
so we think it's an innovative idea, and we have a lot of really smart people working on this.
Well, you got the Air Force behind you. That's a big plus.
It's great.
Can you talk about any specific projects? Are you working on things right now? Is there anything that you can talk about?
Sure. We have, we probably have at any time there's about 15 to 20 projects that are at some stage of development that we're looking at. I would say in the pipeline right now, there's probably 5 or 6 real viable ones. We hope to have our first exit by spring of this year. Some of the areas we're looking at, one sounds very complicated, and it is, but it's called transcranial direct current stimulation.
I don't even know how you said that.
Well, it's what it is at the Air Force. They're flying drones 24/7 in different parts of the world, but there's no computer algorithm to identify what those drones are seeing at any part of the day, and so you have human intelligence, human beings at the other end, looking at that drone coverage 24 hours a day, 7 days a week, 365 days a year.
It's a big job.
And the Air Force was saying, well, how do we make sure that we're not missing anything, that the intention is there? Do you do 4-hour shifts? Do you do 8-hour shifts? And what they found out is if you do stimulation with a direct current, about the equivalent of a 9-volt battery, you can increase the attentiveness by about 50%.
It's amazing.
And then they can map the brain, and they can direct the current in different parts of your brain. And so if you're learning a new language, you can increase the ability to learn a new language by stimulating that part of your brain. And the technology to do that is really being developed out at Wright-Patterson Air Force Base. So you have researchers coming from across the country to do that here. So one of the projects we're working on is involved with the transcranial direct current stimulation. Another one is developing concussion protocol software that allows people to easily identify concussions, whether they're on sporting teams or in the field. So a parent or a coach can do that. So we think that's something that's going to be very useful and,
it's a hot topic right
has
now.
A huge market. And so not only is the device has that cool factor associated with it, but the intelligence and the design behind it and the algorithms and the identification and the science behind it is stuff that's really exciting that's being developed here. And so we're excited about being co-located with the Ascend team, and we think there's going to be a lot of synergy between the hospitals and the base and the Ascend team to develop these products.
So if something is sold out of this program and it becomes marketable, who's then profiting? Is it the hospitals who invested? How does that work?
Sure.
And then who owns it?
Sure. Well, the Ascend Corporation owns it, so they own the intellectual property, and Ascend is made up of 50% of Kaleidoscope and 50% of the hospitals that have invested in it, and then it could be licensed to another company, whether it's Nike or Under Armour or Microsoft, or it could be spun off in its own company and developed here locally. But we want to, the overall goal is not only to have a return on investment, but also to invest in the Dayton region and grow the jobs in the Dayton region. So the genesis of this, we keep going back, is that the hospitals have such a huge economic and employment impact. How do you leverage that economic impact to grow jobs and to grow innovation in the Dayton region? And we hope to attract more young professionals into the Dayton region with these opportunities. So there's a great resource over at Air Force Research Lab. We're partnering with both universities, with the University of Dayton with their research institute, and with Wright State Research Institute. So we have some great opportunities. I think we have some great opportunities for internships and externships. But they're developing things where they're visualizing how products could work, coding them, doing the software development, making them with 3D printers, and then testing them out right here in downtown Dayton. So it's some really great stuff that's taking place in the Dayton region.
There are definitely fascinating things going on. I don't think most people even know are happening right in the Dayton region.
Yeah, and I think part of this is we kind of had a soft launch, and we'll be more public as we start moving this stuff forward. But this is something that the hospitals are not only financially invested in, but also a community invested in, and they think this is a really good thing for the community. And I keep emphasizing how important it is for people to realize that you have Kettering, Premier, and Dayton Children's all working on this together, all coming together with a common cause, and being very supportive of this initiative. So it's they need to be commended.
Something to be proud of.
Absolutely.
What's the long-term goal for this, Bryan? Where do you see this 5-10 years down the road?
Well, 5-10 years down the road, I would personally hope, and I think Ascend would hope, that we would have a number of companies located here in the Dayton region, that the number of jobs associated with those job creations is in the hundreds, not the single digits, and that there's a lot more economic development and investment coming in from different venture capitalists into the region to fund these projects and to fund the development, and have some strategic partnerships with some national companies that would start having a presence here in the Dayton region. So I think that would be I think that's the long-term goal, and I think it's a very realistic goal. The great thing about this program is that, we're not, I don't want to say hamstrung, but we're not limited by trying to figure out, well, what do we have to do in order to get this grant, or what do we have to do to get this government program? This is privately funded, and it is being run by a business. So these are individuals and an organization that has worked with, Johnson & Johnson, Ethicon, Nike, Microsoft, Procter & Gamble, Kroger. So they know how to get products to market, how the business plans work, and we think there's a real exciting opportunity, and we're just happy that they're locating here in Dayton and partnering with us.
I think everyone else should be happy about that
Absolutely.
too. Bryan, if there's anyone who is watching at home and wants to know more or wants to get involved, is there somewhere they can go online or get more information?
Sure, they can go on to www.ascend-innovations.com.
Okay.
There's a website there, and then there's also a listing on that website to submit ideas or projects or potential projects that they may be interested in working with Ascend on. Or they can contact me at the Greater Dayton Area Hospital Association, and they can contact me at my direct line, which is 424-2373, area code 937, and we'll put them in touch with the right individuals.
Okay, so Bryan Bucklew at the Greater Dayton Area Hospital Association. It's just easier to call them GDAHA.
Absolutely.
So if you want more information as well from the Dayton Area Chamber of Commerce, of course, DaytonChamber.org is our website. There's more information on this, which is, again, is called the Ascend Project. It's being led by GDAHA, the Greater Dayton Area Hospital Association. And there's more information about the Chamber, about joining, and member benefits there as well. Thanks so much for being with us.
We hope you've enjoyed today's program. These are exciting times in the growth of businesses and new innovative programs and opportunities in our region. One of the most exciting pieces of news for our chamber is that we've just received word of our continued 5-star accreditation by the U.S. Chamber of Commerce. We've been an accredited chamber since 1995, and in 2000, when the process included the distinction of 3, 4, or 5 stars, we were one of the first and few to receive that top designation. Today's 5-star level rating means we are in the top 1 percentile level of all chambers in the nation. There are only 100 5-star rated chambers in the United States. We are proud of this achievement, but to us it's all about continuous improvement as an organization and making sure we're doing everything we should be doing within our resource structure to be the business community's best chamber and strongest voice for businesses in our region. It is our honor to serve our metropolitan Dayton community. As one of the oldest, largest, and best-known chambers in the nation, we have been at this for over 108 years and look forward to serving our region with distinction for another 100 years or more.